Slings for incontinence are also made of mesh, and mesh has a bad reputation out there. As we've discussed in other videos, mesh is neither good nor bad. However, it's important to differentiate between a sling and a mesh for pelvic reconstruction. Mesh for pelvic reconstruction is a hammock that is holding the bladder up all the time. Because of that, it is constantly under load. It is constantly doing something to protect your bladder, to hold your bladder up, and therefore is more fraught to have complications. A sling is more like a seatbelt. It only works when you need it to work. So if you envision this is the bladder and this is the urethra, normally when a woman coughs or laughs or sneezes, the bladder will drop, but the urethra kinks like you kink your garden hose so that the extra pressure of the cough meets more resistance, because the support for the bladder goes under the bladder but around the urethra on its way up to the pubic bone. As we get older, having children, etc., etc., we lose some of that support. And when that happens, when you cough, the urethra drops with the bladder. The way a sling works is it is a seatbelt that goes under the urethra. It does nothing until you cough and it catches the urethra. And the reason that works so well and has so few complications is it only works when you need it to work. In fact, slings are the most studied anti-incontinence procedure in the world, with the highest cure rate and the lowest complication rate. They're made out of polypropylene, which is important. The classic surgery we did for this, through a C-section-like incision, a fan and steel incision, was a Birch or Marshall-McKenzie-Krantz procedure, MMK. Those procedures, we use a suture of polypropylene, the same material that the sling is made out of. We do 1 to 3 stitches on either side of the urethra, suturing it up to the pubic bone and anchoring it. The difference being that often a sling patient goes home that night without a catheter and is cured, whereas a Birch or MMK has a higher rate of bleeding as a complication because we're opening up a large vascular space. It has a higher rate of urinary retention, that is difficulty urinating, and people often go home with a catheter for 1 to 2 weeks, as a longer hospitalization and a longer recovery because it's a larger incision. Slings are typically done through 1 to 3 incisions this big. In fact, they're so small that the external incisions are often glued, not sewn shut.